Welcome to another video from my website, trustedmedicareadvice.com. My name is Philip Alston. I'm a pharmacist as well as an independent insurance agent. My goal here is to help you learn about Medicare. Once you understand how Medicare works, together we can find plans to match your health needs, your lifestyle, and your budget. I'm located in northeastern Broward County, Florida, just south of Boca Raton. And I'm also licensed in the states of Georgia, Illinois, and New Jersey. The topic of today's video is Medicare Part C, also known as Medicare Advantage Plans. For those who are eligible for Medicare, Medicare Advantage Plans offer an alternative way to get their Medicare benefits. Unlike original Medicare from the federal government, Medicare Advantage Plans are administered by private for-profit insurance companies contracted with the federal government. When you enroll in a Medicare Advantage plan, you no longer get your benefits directly through the government. The private insurance company provides the benefits that you would get under Part A and Part B of Medicare. They also provide a number of additional benefits that original Medicare does not provide. These private insurance companies use a managed care model for the provision of benefits. Managed care means that the plans from private insurance companies can impose certain restrictions. Examples are utilization of networks of authorized providers, such as doctors, hospitals, medical supply companies, and others, requirement of prior authorizations for procedures and services, requirement to have a primary care physician to coordinate care, the requirement of referrals by primary care physicians to specialists, step therapy, which means trying less expensive treatments prior to using more expensive options, and even potential denials of service when deemed appropriate by the insurance company. But of course, there is a 5-step process of appeals for your protection. The most common types of managed care plans under Medicare Advantage are HMOs, which are health maintenance organizations, and PPOs, Preferred Provider Organizations. HMOs have the most restrictions, but also offer the most added benefits. Added benefits may include prescription drug coverage, dental services, which can range from very basic to comprehensive depending on the plan, vision services, hearing services, silver sneakers or similar health and fitness programs, transportation services, financial allowances for purchase of OTC medications and health items, meals after hospital or rehab facility stays, healthy food assistance, and possibly other services. HMOs have the strictest and smallest networks of providers. They are often geographically limited to a single county or a few adjacent counties. HMO members have no coverage outside of the network, except for emergency coverage. PPOs are less restrictive than HMOs, but the added benefits are not as generous or plentiful. PPOs generally have much larger geographic networks, such as entire states or groups of neighboring states. Most PPOs allow members to see any doctor that accepts Medicare, but using doctors that are out of network will be at higher out-of-pocket costs than if they stay within the network. Some PPOs from large insurance companies may allow members to utilize their networks in other states while traveling and still be considered in-network. Most PPOs do not require referrals. HMOs and PPOs are both pay-as-you-go plans. This means that there are co-pays to pay when using services like doctor visits, lab tests, x-rays, ambulance service, emergency room treatment, hospital stays, the list goes on. In many areas, there are zero premium Advantage plans, but that does not mean that the coverage is free. In fact, when someone gets seriously ill and uses many services, the costs can add up fast. Fortunately, these plans all have maximum out-of-pocket limitations set by Medicare, commonly known as MOOP. For 2021, the MOOP for HMOs is $7,550. For PPOs, the MOOP is $7,550 in-network and $11,300 out-of-network. In competitive markets, such as South Florida, the insurance companies offer much lower MOOPs on their plans. Note that for plans that include prescription drug coverage, the maximum out-of-pocket does not include or does not apply to prescription drug coverage. There is no limit on prescription drug out-of-pocket costs. So please see my video about Part D prescription drug plans for more details. In order to be eligible for a Medicare Advantage plan, you must be enrolled in both Part A and Part B of Medicare, and you must continue to pay your Part B premium to the government. Failure to do so will cause you to lose your Part B, and then you will lose your Advantage plan as well. The reason behind this is that the government pays a monthly amount to the private plans for each Medicare beneficiary on a Medicare Advantage plan. This is the money that the private plans use to provide services and earn their profits. It's a common mistake for people on zero premium Advantage plans to misunderstand and to stop paying for Part B. Then they lose their Advantage plan and may go for many months with no coverage at all. Please don't make this mistake. These private Medicare Advantage plans are one-year contracts. Because of this, the benefits and details of the plans can and often do change from year to year. Members will receive an annual notice of change, an ANOC, every September, detailing any changes for the upcoming year. Watch for it in your mail or in your email, and be sure to check your spam or junk folders so you don't miss it. Members have an opportunity to change plans if they find that their current plan will no longer meet their needs. This opportunity comes during the annual enrollment period, AEP, also called annual election period, which goes from October 15th to December 7th. Any changes made during AEP will go into effect on January 1st of the coming year. Thank you for watching, and if you enjoyed this video, please give it a thumbs up. That helps other people find it as well. And if you're new to Medicare, I've got a quick reference guide called It's Time to Learn About Medicare. If you'd like a copy, or if you just need help with Medicare plans, give me a call at 1-800-492-1163, or you can email me at trustedmedicareadvice@gmail.com. And don't forget to visit my website for lots more information, trustedmedicareadvice.com. Once again, thank you so much.